The gondolas of Venice are back on the water after being stowed away for months because of a city-wide lockdown. Locals organized a race that they hope will bring back visitors when its borders reopen on July 1st.
The objective of the race was to attract news attention, to show that the town is alive. We must tell our people to go back to school, to go back to work, while taking all the necessary precautions. We must start again.
But not everyone is welcome. The EU plans to only allow visitors from countries that have effectively contained the spread of COVID-19. It will consider the number of cases, deaths, and the rate of spread. This criteria could shut the doors to Europe on US citizens, at least for now. With nearly 2.4 million people infected and 123,000 deaths, the US is the world's worst affected country. And its average number of new infections per day over the past 14 days is 107 per 100,000 people. That puts the US in the same league as Brazil and Russia according to the EU's criteria. Around 18 million Americans visited Europe last year, the highest number of visitors from any country outside the economic bloc. Keeping them out would deprive businesses of billions of dollars in revenue. And the economic pain will spread as businesses everywhere contend with slower demand. The IMF says the global economy will contract 4.9% this year and lose $12 trillion over 2 years due to the coronavirus crisis. These predictions are much worse than its previous forecasts.
So we are definitely not out of the woods. We have not escaped the great lockdown. Given this tremendous uncertainty, policymakers should remain vigilant and adapt policies as the situation evolves.
US officials admit they are struggling to stop the spread of the disease, and a quick resolution appears unlikely.
Right now, the next couple of weeks are going to be critical in our ability to address those surgings that we're seeing in Florida, in Texas, in Arizona, and in other states. They're not the only ones that are having a difficulty.
Back in March, US President Donald Trump temporarily banned travelers from most European countries while criticizing the bloc's inability to contain the pandemic. The move strained relations between Washington and Brussels. Now, as the tables have turned, an EU ban on US travelers could raise the toll on business and diplomatic ties between the allies. Mobin Nasir, TRT World.
For more on this, Dr. Eric Feigl-Ding joins us now from Washington. He's a senior fellow at the Federation of American Scientists and an epidemiologist at the Harvard Chan School of Public Health. Welcome back to the program, Doctor. Now, you were one of the many health experts who were warning against the rapid reopening of the US economy, and it appears that the states that have done so are now paying the price. But tell us, what's behind the surge in infections in places like Florida, Texas, and California?
Yeah, happy to be back. Unfortunately, what's happening in these states, these Sunbelt states in the South, are that these governors reopened way too quickly. Other places, they have more phased reopenings, but they reopened much faster than other states in the North. And moreover, there is much lower mask wearing compliance. And I cannot stress enough, mask wearing is one of the most critical tools we now have, especially that the political will to do lockdowns and shelter in places are virtually nil. So mask wearing, though, has become politicized in a lot of Republican and conservative areas, such as these states like Florida, Texas, Arizona. Mask mandates have not been in place. And so the mask wearing prevalence is so low, and hence we have this epidemic.
That's right. Now, the surge in cases has even prompted states like New York, Connecticut and New Jersey, which have, I guess, handled the reopening more gently and have been more vigilant with their measures. Now, they're proposing to actually quarantine all travellers from those hotspot states for 14 days upon arriving in their states. Do you think this is an appropriate measure by New York, Connecticut and New Jersey?
I think it is a very appropriate measure. I have a few questions, concerns. One, first of all, we may have to expand that list of states that travelers are coming from that may need to get this quarantine. Two, I think additional states may also have to follow New Jersey, New York, and Connecticut's lead and also restrict their travelers who come from those southern outbreak states. But the problem also is that in the US, we don't have a sense of borders between states. It's not like EU has countries where there is still borders checks sometimes if they wanted to impose it again. But US has no borders, and how are you going to verify them? It's very difficult to enforce this. But is it valid measure, an appropriate measure for restricting travel? I think so. It is very prudent, but carrying it out will be the hard part.
Just looking at some of the numbers which have come out of Florida. So on Tuesday alone, the state recorded around 5,500 new infections, setting a new daily record. And apparently intensive care visits, ventilation use has also risen in the state. What do these governors need to do in order to tackle this new surge?
Yeah, Florida's epidemic is just, it is beyond, it has been frustrating. We've been raising the alarm about Florida for the last 2-3 weeks. And I think if it gets too hot, we may have to go into another lockdown. Whether politically that's feasible, Governor Ron DeSantis is one of Trump's most loyal governors to pledge fealty to him. And the problem with that is that if Trump is not advocating for lockdowns or shutdowns, these governors will be very difficult to defy them. And I just pray that they set good leadership and at least at minimum mask mandates. And we need 95% mask compliance in order to lower and slow down the epidemic to containment levels. But I don't know if we will see that from this leadership in Florida's governorship.
Now, as I mentioned, some states in the US are looking at quarantining travelers from those hotspot states. But as we heard in the story, the European Union is also considering a ban on US travelers given the rise in infections in some parts of the country. Is that a measure that you would support?
I would support it. It is a very difficult thing, but I think the U.S. epidemic right now is so severe that it may be warranted. Because U.S. never reached the bottom of its first wave. We're resurging, but I would say this is the second peak of America's first wave. And the problem is it's now exceeding most countries. And it is becoming so prolific, I don't see any way of containing it domestically for the next 2-3 weeks. Dr. Fauci says next 2 weeks is critical, but I don't think U.S. is containing it given the political willpower is not there and the mask-wearing rugged individualism of America is not supporting that. So I think unless the U.S. has a quick downturn in the next week or month, I don't think the European Union can stop this ban that's been proposed from being implemented. I think they may have to do it.
Yes, it's certainly a concerning time for the United States, to say the least. Dr. Eric Feigl-Ding, thank you again for joining us on the program.